All right. So, thank you everyone for joining. I'm Jessica Rubin, for those of you who don't know me. I'm a transplant hepatology fellow at UCSF. And I'm going to be moderating the panel tonight. And so thank you to all of our faculty who have joined us. The way this works is everyone, if you are not the faculty, if you could just stay muted, that would be great. And then if you have any questions, we'll have hopefully a lot of time at the end for questions, but you can just chat them to everyone or to me privately if you want in the chat box. And then, we can do it that way. And we have a few questions to get started with already. Before we start, I just wanted to take a minute to remind you about an upcoming event for the Northern California Society of Clinical Gastroenterology, our virtual liver symposium in January. And because it is a virtual symposium, we are able to take advantage of not making everyone in one place for all day. So it will be 4 Thursdays is how the structure will be, the 4 Thursdays in January. And so hopefully you can all join us for that. So with that, I wanted to just briefly introduce the 5 panel members who, again, we thank so much for joining us. And the theme of, several of you joined us for the last session last month, but the theme of this month is sort of comparison between practice settings. And so we have 5 wonderful guests who have all practiced in a couple of different practice settings, at least over their careers. So first up, we have Craig Monroe, who is an advanced endoscopist. He was previously the chief of GI at Kaiser San Francisco from 2017 to 2020. And just as of last month, he started with us at UCSF, where he is the Associate Chief for Clinical Innovation for our division of GI. Next is Jeff Lee, who I guess sort of flip-flopped with Dr. Monroe. So he is a general gastroenterologist at Kaiser San Francisco and is a clinical researcher at the Division of Research at Kaiser Northern California, and has a research interest in cancer prevention. And he previously was a faculty member and gastroenterologist and researcher at UCSF. Christina Cho is she's trained in hepatology and motility. She was previously at CPMC, and now I believe, though she'll tell us more, is doing general GI at Alameda Health System. Next, we have Robert Wong, who is an associate professor of GI and hepatology at Stanford, and he is based at the Palo Alto VA, where he recently moved from Highland Hospital in Oakland, where he was a gastroenterologist and hepatologist over there, as well as the director of research at Alameda Health System and the CPMC GI Fellowship. And then last but certainly not least is Nizar Mukhtar, who, after finishing his transplant hepatology fellowship at UCSF, was recruited to Swedish Medical Center in Seattle, where he was a hepatologist and a transplant hepatologist up there. And then came back down to the Bay Area, where I think he's been now for about 2 years as a gastroenterologist and hepatologist at Kaiser San Francisco. Different practice settings represented here. So I think how we'll start is give each of you about 4 or 5 minutes to talk about your career transitions. And in particular, since our audience is mostly, but certainly not exclusively, trainees who may not be at a point of switching jobs, but really looking for initial jobs out of their training, we're really interested in what advice all of you have on really how to think about practice setting in a job search, and when considering a job, how to think about that in particular. So without further ado, I guess we can start from the the top of the list, which I read before. So Dr. Monroe, if you are here, would you want to start?
Yeah, absolutely. Can everyone hear me?
Yeah, we can hear you.
All right, excellent. Well, first off, thank you for the invitation. It's just, I'm driving and so my camera's gonna be off. Once I get home, I'll switch my camera on, but it's just really nice to see Dr. Mukhtar, Dr. Lee. I see Dr. Gut and Dr. Lamb, all my old peeps from Kaiser SF. And yeah, so, you know, I made the switch to UCSF in August of this year. I left just about a month or two after COVID had started. So it was a difficult time to make the transition. Ultimately, I think, you know, just the way I made my decision was I wasn't running from anything. I think it's very important being in a leadership position and seeing people applying for jobs, that when you make a decision to leave, that you do it for a compelling reason and you're not running away from something. Or if it's a work volume, if there are things about your job that you don't like, my first piece of advice would be try to fix those things. If there are things about or innovate on, that's when you should start looking elsewhere. You know, I left a very, very, very healthy group at Kaiser SF, and I was very happy in my position.
Dr. Monroe, I think you were cutting in and out a little bit while driving. So I don't know how long it will take you to get home. Should we have other people, should we recircle back to you in a little bit, or what do you think? Yeah, I think we'll do that. Dr. Monroe, yeah, you're cutting in and out. We can't actually hear you. So so we'll come back to you. So let's move on to Jeff Lee, if that's okay.
Yeah. Hello, everyone. You know, it's truly an honor to be able to kind of share my thoughts and be able to tell you about my thought process in terms of, you know, kind of changing jobs during my early parts of my career. So I started at UCSF, and that was my dream job. And that still, you know, the coworkers over there were amazing. I loved it over there. And I spent 4 years building my career over there, and I thought I was going to end my career over there. And so it was during my third year, during my end of my third year, where there was an opportunity to be able to kind of continue my work. And I was doing a lot of research. So my time at UCSF was 50% clinical and about 50% research. And my research time was actually supported by an NIH grant and some, you know, foundation grants. But my work and my research were pretty much focused on colorectal cancer prevention. And my research was actually based at Kaiser Permanente, Northern California. So it was really, you know, it was a really interesting setup in the sense that my clinical work was all done at UCSF, but a lot of my research was done at Kaiser. And the reason why it was, you know, a lot of the work was done at Kaiser is because I had an outstanding mentor at Doug Corley, and my cohort was there. And so, as many of you guys know, for clinical research, it's about your cohort and the ability to be able to have your findings to be able to translate into policy and part of the health system, to make changes within the health system. That was there was an opportunity to be able to join Kaiser Permanente that year, or after my fourth year. And so that was kind of one of the main motivations for me to consider that job at Kaiser Permanente in San Francisco. So actually my job is 2 blocks away from my old office. So I didn't really have to move far. So it's really, you know, wasn't too hard of a move. But my practice is much different in terms of, you know, at a university setting, you know, I was very an RVU based, and clinically, you know, it's about building your brand as a referral person. And going to Kaiser Permanente, you still build your brand within your health system, but it's a lot different. It's not an RVU based system, and so clinically, I do the same type of work that I did at UCSF. It was just a different setting, and so it's quite funny to be able to be in the same kind of discussion group with my former chief Craig, and we traded spots, and so it's always great to be able to hear from him and be able to see old faces. So thankful for the opportunity, and happy to answer more questions later.
Wonderful, thank you, Jeff. Next, we'll move to Christina.
Wait, hold on. Sorry, I'm trying to do the video thing, but maybe it's not working. Anyways, sorry, I think my video isn't working, so I'm just gonna get started talking. So I'm Christina Cho. Oh, okay. Oh, now it's working. Okay, good. Okay, so I'm Christina Cho. Right now I'm at Alameda Health System, but before I was part of the Sutter West Bay Medical Group, which was a multi-specialty group, including primary care services, along with other ones such as organ transplant. My practice setting was a little bit different than just general GI because I was part of a subspecialty. Because we had primary care doctors there, I would get referrals from primary care doctors, but my referral base also included general GI doctors because of my subspecialty. And I do feel valued as a doctor with a particular expertise because I get to have the experience to do motility procedures and also participate in management options that are not widely available. But one of the things about this practice is because we're oftentimes a second opinion, sometimes even fifth opinions, there can be, a lot of prior workup to review, and sometimes their patients come in with multiple different complaints. Oftentimes they're generally not straightforward, so it can take more time to take care of these patients. I do have to say, being at CPMC, and despite taking care of these patients, one of the things that I really enjoyed was working with the trainees, mostly the GI fellows. We worked with them really closely, and to me, that was one of the things that brought joy at this job. And on top of that, for me, job, all jobs can be busy. However, for me, one of the main things is also your support staff, your MAs, and also your colleagues. I had, despite how busy it was, I just feel like I always had a lot of fun talking to my colleagues, working with my MAs and things. So that our support staff was awesome. And I just feel like, our manager always had our best interests in mind. So for me, staff was really important in looking for a job. I think one of the things I had to say about the practice would be that sometimes change can occur very slowly, and therefore I think it's just because we're oftentimes reliant on administrators to help us with change and things. So that was one of the things that I felt like happened slowly. Now, comparing that to my job at Highland, Highland mostly we're stationed at Highland Hospital, although now we also go to the other hospitals that are part of the Alameda Health System. It's basically a safety net county hospital where my job here is more as a general gastroenterologist. It's not RVU based. So I don't have to think too much about that. And also working at Highland Hospital, I like it a lot because of the diverse patient population. And that's one of the reasons why I wanted to switch. I definitely saw some county patients while I was at CPNC. And then because of that, I really like this patient population. And that was one of the reasons why I moved over to. And then also being at Highland, because it's a teaching hospital, I realized that, I wanted to participate more in research, and then Highland provided me with that opportunity, from mentoring medical students all the way up to even GI fellows at CPMC again, because we work together and they often rotate here. So for me, this was kind of a win, and one of the reasons why I moved here. Again, because it's a county hospital, resources can be limited. So oftentimes I do have to jump through hoops trying to get medications for patients, and also just sending patients for advanced endoscopy procedures. We don't have that service here, so I have to send them to other places, and we have to frequently follow up and make sure the referrals go through. And also, again, change happens very slowly here. That's another thing. One of the things, the downsides here. However, again, to me, colleagues are important. I also really like my colleagues here, my staff here. And so definitely one of the things I look for when I'm looking for a job and things. So yeah, so for main thing for me is the teaching and also, you know, colleagues and the diverse patient population. And that's why I decided to switch to this job. Okay. We can save questions for later.
Yeah, we'll do questions later, but that's a good reminder. For anyone who has questions, please chat them in the chat box, either to me directly or to everyone, so that we can make sure to get all of our questions answered. So we will move on to Robert at this point.
Great. Thanks, Jessica. And thanks, everyone. It's so nice to see familiar names and faces on the participant list. So my transition story actually starts off where Christina left off. So I was at Highland Hospital for about 6 years. It was my first job coming out of fellowship. And for me, choosing that job was a combination of factors there that really drew me to be interested in that specific population and that specific job. As Christina mentioned, the population at Highland is primarily safety nets, underserved ethnic minority populations, and that sort of jived well with me coming out of fellowship, as a lot of my interests, particularly in clinical research, was on understanding healthcare disparities. The other important aspect of the program was it's a teaching program, both with residents and the integrated fellowship from CPMC. And for me, for personal reasons, it was close to home. So my family, immediate family, is all in Oakland, so it sort of made sense for me at the time to move back home to Oakland. So I, like Craig, I recently just transitioned too during the COVID epidemic or pandemic. I just moved to the Palo Alto VA June of this year. So I've been there for about 5 6 months or so. And I don't know, I guess the point of this is to sort of share the thought process and decision-making process. And for me, the process of moving was sort of prompted by a reassessment of goals, where I am in my career development trajectory, what the current situation offers, and was it a good match, or was it still a good match for me in terms of what I envisioned and saw myself in my long-term career. And so the reason that prompted me to move was I was getting more and more interested in further developing a career in clinical research, and sort of sought out different opportunities to be in a in a more resourced environment, I guess, in terms of opportunities for funding for clinical research, and as Jeff actually pointed out so well, for us clinical epi and clinical researchers, the cohort is really key. And as you know, Jessica, the VA cohort is such a rich database of patients and patient outcomes, and it was very attractive for me when a position, an opportunity popped up to jump over to the VA. So I guess, in summary, a couple key points I would say for people on the call, for people looking for jobs initially, I would just say the tips are, as evidenced by all the panelists here, just remember your first job is not always your last job. And it's okay to join a job and try it out and see how it fits and matches your expectations. The second teaching point, or I'm sorry, not teaching point, the second advice I would give to early faculty or trainees is make sure to reassess it's good to reassess your situation after 3 or 5 years. I think reassessing too early is potentially dangerous, but reassessing after 3 to 5 years, I think, is appropriate, is healthy. Not just reassessing the situation where you're at, but reassessing yourself. What are your goals? Are your goals still the same they were when you left fellowship? And how your next 5 to 10 years really look like, and what environment or situation can best help you achieve those goals. So I will stop with that and wait for the Q&A.
Wonderful, thank you. And last but certainly not least would be Nizar.
Hey everyone, this is Nizar Mukhtar. Thank you for inviting me to talk today. Thank you, Jessica, and other workshop organizers. I think it's always inspiring to hear the stories of others, and I'm even inspired just hearing from my colleagues today. And I think all along my training and as a young faculty member, I always find it helpful to gain the perspective of others. And so I think hopefully I can share a little bit about my journey, and hopefully that's helpful to some of you. I'm currently Director of Hepatology and Associate Program Director of the GI Fellowship at KP Northern California here in San Francisco. I did my undergrad at University of Maryland. I'm originally from East Africa, from Sudan, and grew up between New York and Khartoum, Sudan, where I'm from originally, and came back to the States for college. Initially in the DC area at University of Maryland, which was wonderful. Then moved to Nashville, country music capital of the world, to go to Vanderbilt, which was actually amazing. Highly recommend it. Anybody who's looking for jobs there, fantastic hospital. And then finally made my way out west to beautiful San Francisco. And joined UCSF initially as an internal medicine resident, and stayed on to do GI and transplant hepatology. And I was actually their first pilot fellow to do the combined GI and transplant hepatology fellowship, which I highly recommend. Now it's an established track for trainees to follow. I subsequently got lured up to Seattle to Swedish Medical Center by Oren Fix, who was one of my faculty at UCSF, and was really attracted to join the program there, in large part because it was a new transplant program in Seattle, and really the prospect of being part of a new program and helping to build something was really exciting to me. And I was really excited about the opportunity to be kind of thrust immediately into leadership positions, and really help to guide the administration in growing the program. And so I initially had gone up there almost as a courtesy just to Oren, just to interview and not insult him, and ended up being amazingly or pleasantly surprised by the vision of the program and the organization, and stayed on there as a transplant hepatologist for about 4 years before coming back to San Francisco to take my current role at KP, and I'll speak more to that. I think in general, like many of you and many of our panelists, I was attracted to medicine and GI, and then specifically hepatology, really because of all the opportunities it affords you to kind of explore interests outside of just patient care. For sure, being at the patient bedside is my greatest passion, but being able to engage in other things like medical education, health disparities research, quality improvement work, community outreach, global health, all these things that our colleagues are speaking to as well. That really excited me about hepatology, and that's why I decided to pursue that. If I could use my time to make any plug, it would be that, when you're pursuing hepatology positions, many of us trained at university medical centers. And for me, the idea of a transplant hepatology position in a private practice was kind of foreign to me. I didn't know what that would look like. And what I came to learn is that really you can find, equal, if not more, opportunity to pursue a lot of academic and scholarly and administrative pursuits in non-university settings, if that's something that's important to you. On the flip side, really promotion or career advancement in these settings is not necessarily tied to those academic pursuits the way it is in like university medical centers. And so there are many colleagues who prefer just to focus on patient care, and that's perfectly fine and tends to align very well with medical center priorities. But I think if I could leave you with anything, is that if those are things that are important to you, part of your priorities in exploring career options, I would keep an open mind and really look at all practice settings, because you'd be surprised. As far as what exactly do hepatologists do in private practice, both in my role at Swedish Medical Center and here at Kaiser Permanente, primarily responsible for managing patients with acute and chronic liver disease in both the outpatient and inpatient setting. We play, very central role in peri-transplant, in pre-transplant evaluation and peri-transplant management of patients with end-stage liver disease. We really take a lead in, leading liver cancer care for patients, within a multidisciplinary setting. And then many hepatologists do endoscopy as well, at the very least EGD and colonoscopy, and some even have expertise in ERCP. And really, the amount of time you spend doing general GI responsibilities and endoscopic responsibilities really can vary widely from one practice to another. So I'm sure you will find something that meets your needs as far as still maintaining some degree of hands-on procedural activity. In terms of academic and administrative pursuits, as I mentioned, that's something that was very important to me. There are like an abundance of opportunities at almost every medical center, whether in a university setting or not, to engage in medical education, research, and these kind of things. So for sure, do not exclude a private practice position if you're considering kind of a career in academic hepatology. I don't want to keep rambling too much. I would say, as far as kind of words of advice when you're pursuing positions, I think something that was told to me when I was looking for jobs, and I thought it was very helpful, is to realize your own self-worth, that you have, you bring a very unique skill set, whether you're doing general GI or a subspecialty within GI, you're bringing a unique skill set to any medical center. You're going to be adding value to that organization and to the care of patients. And you really need to bring that kind of mindset when you're looking at positions and negotiating for various positions. You should not be afraid to ask for what you want. I think really what is a major detriment to yourself is not asking for the things you feel like you need to be successful in your role at the outset. And I think if I've learned anything, is that if you don't ask for it, you're probably not going to get it. Okay, so you need to ask, and you'd be surprised. People are willing to go the extra mile to make sure you're happy and set up for success. So definitely think about that. Learn about your colleagues, your future colleagues who you'll be working with, not just in your immediate practice, but in the medical center as a whole. Try to get a sense for what the culture is like at the organization, because in the end, these are the people you'll interact with day in and day out. And especially for the care of patients with liver disease, it really does take a village. So you want to be working with people you admire, who you trust, who are at least happy, or at the very least find some sort of fulfillment in helping you care for patients. So try to make effort to get to know a little more about the culture of the organization you're working. Factor in things outside of your work, like life, your hobbies, your interests, your family, friends, proximity, as Robert and others spoke to. That's something that's really important. Like, I can't overstate the importance of that. For me, being in Seattle, I loved my job, but I was so far away from So many of the friends and family I developed here in the Bay Area, and some of my immediate family here, that it became too much to overcome as far as thinking of pros and cons of staying there. Keep an open mind and explore opportunities in various settings. You don't lose anything in at least learning about positions and visiting places. I think you'll never be disappointed in doing so, and you'll be amazed at all the relationships you'll form along the way. And then talk to your mentors, your family, your friends. Share with them, what your concerns are, what excites you about job opportunities. Just having those discussions will help you establish what your priorities are, as Robert spoke to, and help you kind of figure out if a certain job aligns well with your priorities at the time. And then the last thing I'll say is trust your instincts, trust yourself, go with your gut, no pun intended. It'll usually steer you in the right direction. When you find a job that's good for you, you'll know, and you'll feel very, very happy about accepting it. And I think for the most part, it's a very rewarding career to be in, GI and hepatology. And I'm very excited for you all, and you should take full advantage of all mentors and everyone on this panel. We're happy to answer any questions. I'll stop there.
Wonderful, thank you. And Dr. Monroe said he had bad service, so he's going to try and log back on when he gets home. So maybe we'll give him the floor at the end. So I think we can go into questions. We had one question in the chat box, which I'll get to in a minute. But I think one thing that maybe not everyone on this call knows about and came up a couple of times, I think Jeff and Christina both mentioned this, is whether a job is or is not RVU based. So I was wondering if you guys could talk about what exactly that means and how to think about that when you're looking at jobs. And I don't know if Jeff, because you brought it up, if you wanted to just mention that, because I know you've had been in a couple different systems, as most people have, but I think it would be helpful for some trainees who may not know exactly what that means. Yeah,
happy to share that. So at UCSF, it's a RVU based, and many university based programs in private practice. It's pretty much RVU based. And so, that is essentially the metric of how it dictates your salary. And it's just work productivity. It's a fair system that reflects the amount of work that you're doing, or, kind of captures the amount of clinic patients you're seeing or the complexity of patients you're seeing, but also the number of procedures you're doing. And we're in GI and we do a ton of procedures, some of which are more complex than others. And each of these procedures reflect, an RVU. So when you first look for a job, you have to, one of the key things that you want to know is what is your RVU target, or what is your RVU goals? Whether it's like 1,000, 2,000, 6,000, whatever. And how does that reflect upon your salary, and knowing that how does it correlate with the salary? And the second thing you want to know is how is your employer, whether it's a private practice group or a university system, how are they going to be able to allow you to make those RVUs, or accomplish, or be able to achieve that RVU goal? So you really want to make sure, when you look for a potential employer, you want to ask them, how are you going to be able to achieve those goals? And so a lot of the RVUs that we achieve are from procedural base. And so if you go to an employer that says, I would prefer you to go see clinic, do 5 days worth of clinic, then that's going to be really hard to achieve your RVU goals, whatever that is. So you want to be able to kind of, look into, discuss with your potential employer, how much time will you be afforded for endoscopy? Do you get set block times? Are you competing with anyone? Is this your room all to yourself? I think those are things that you want to be, set up for success, and to meet your target and to accomplish your career goals. And so, so for me, my first 4 years at UCSF, it's RVU based. I was able to achieve all my RVU targets. How I did that was really just being, asking for, can I have clinic this day? Can I optimize my endoscopy time during this time? And so having that flexibility is really important. But ultimately, you obviously, as you walk in, it's hard for you to know how to optimize your RVUs and meet your target goals. And so you have to work with your employer to be able to come up with a plan that works best for both you and the employer to achieve your goals. So I came in with the RVU target, an RVU job, and then I went to a salaried position where it's non-RVU based. It's really just, you see an X amount of patients during this block time. And so as you know, it's very similar to like the VA or maybe a county hospital where it's more salaried. Very rarely do you see a private practice that is a salaried without an RVU target. So hope that's helpful.
Yeah, very helpful. I don't know if any of the other panelists have anything quickly to add about RVUs or how to think about that coming into jobs and for people who may not be super familiar with it.
Yeah, I would just say, at least this is Nizar, for the hepatologists or budding hepatologists, I think it does come up quite a bit for hepatologists because we're primarily, not doing as much procedures as our general GI colleagues. And so I think if you are considering an RVU-based position as a hepatologist, you should, find out how are hepatologists meeting that goal. Is it through inpatient time, like, serving as attending on the inpatient service? That can often be a good source of a lot of RVUs. And then if not, is there space for you to do endoscopy? I know at least in Seattle, I had a salary-based hepatology position. And so I actually wanted to do a lot of endoscopy for my own patients and found myself like having to fight with the gastroenterologist for endo room because they were all, RVU based. So it's something for sure to at least inquire about and have a sense for what the strategy is around that. Usually you're able to meet the RVU targets you need to meet somehow. But like Jeff said, to rely on clinic alone is not an ideal situation for getting RVUs.
Wonderful. Thank you guys. Very helpful. So in the chat box, one of the questions was, what are some of the important factors fellows should look at when looking for the first job that we might not think about? What are things, I know you guys alluded to some of those things, but is there anything that, we may not think about or consider that we should be thinking about? I think the RVU target and how you make that is a really important one. So we kind of already addressed that, but anything else?
Yeah, one thing I would add in terms of looking for jobs, when we were assessing jobs out of fellowship, we're sort of balanced. There's rarely, I would say, a perfect job. So we're sort of balancing all these pros and cons, benefits, salary, location, job description, opportunities for growth. And I think all of these things are so important. One thing I would maybe caution people when looking for jobs is cons are not always negative in the sense that, when you see potential deficits or things that are lacking in a program or a position, I would encourage people to be open-minded because these potential downsides of a position can actually turn out to be great opportunities for growth. For example, a program that perhaps is less structured or may not have a very structured research program, for example, may be a potential strength in the sense that you can develop a program or develop a structure and you have a lot more flexibility to build the kind of program you want. So I would just encourage people when looking for jobs I think it's important to think about the pluses and negatives as it relates to your own goals, But oftentimes, just be aware that not all negatives are negatives, and you can certainly turn lemons into lemonade, so to speak, in terms of your own career goals and objectives.
Great, thank you. I see that Dr. Monroe is back with us. So I don't know if you wanted to speak from where you left off, or just jump in with the questions. So we are right now, the question was about what are the most important factors fellows should look at when looking for their first job that they may not otherwise think about? And he may have dropped off again. Okay, so any other thoughts on answering that question from Jeff or Nizar, Christina? Any other thoughts on important factors that we may not think about?
This is Nizar. I would say, I think it's important. I think I like what Robert said, and I think that's part of what attracted me to come to KP, is that I got the sense from the leadership that they were open to having input on how to build and improve the program. And in particular, in our case, you know, we were starting a GI fellowship, and so that was really exciting to me. Like, I wanted to be, you know, similar to the reasons that pushed me to go to Seattle. I wanted to be part of, you know, building something new and helping it to grow and thrive. And so I think when you're you know, exploring job options, like Robert said, you know, if it doesn't exactly have, you know, everything you want, I think that's perfectly fine, and actually may make it even a more stimulating job for you. But the key is to make sure you are going to be working with people or for people that are you know, motivated to help you along the journey and are not going to obstruct you. And so I think you know, just again, just speaks to getting to know the people there and talking, you know, to others about the culture, because I think there are a lot of places where, you know, they're just kind of set in their ways and this is just how it is, and you know, that's it. Whereas many are open to innovation and change and progress. So those are things that appeal to me in every job I've pursued, and you get a sense, you know, just from talking to people.
Just another thing to add to the question that Liat addressed. You know, one thing I never thought about, and I'm very thankful that both of my, you know, kind of workforce or workplace has provided me, is access to just experts that are outside of my expertise. You know, having, you know, we take it for granted for having someone that's a biliary endoscopist or a pancreatologist or you know, kind of a liver expert. And so having that access, it just makes your life so much easier in terms of, you know, I heard from Christina earlier that she has to, you know, think about finding, you know, an interventional endoscopist to do in the US, for example. I mean, those are things that are just extra work that you have to do. But if you have the luxury and if you have the opportunity to interview at multiple areas, those are things to think about. I mean, that I never thought about. It's just having colleagues that are just flexible, that are really good at what they're doing, that are actually, you know, very helpful in terms of providing their expertise. So I've just been fortunate, and something to think about on top of the many things we've talked about earlier.
Great, very helpful. I think an interesting question that Tim asked, and is it common for have restrictions practicing in the same city or general area if you decide to change? I know for a fact in Seattle that is a very common thing. I don't know actually about the Bay Area, but I'm interested how common your experience has been with restrictions on practicing in the same metro area should you decide to switch.
Yeah, this is Nizar. I just want to confirm what you said. In Seattle, they don't mess around with that. Swedish doesn't have that, I don't think. But I think Virginia Mason, one of the other main medical centers, and I want to say even the University of Washington.
Yeah, the University of Washington.
Yeah, they don't mess around. They don't like people jumping ship to another center. I think, you know, within, I don't know even how many miles. But it is something to clarify in your contracts. I don't think it exists in the Bay Area. I don't know if others could speak to that.
It's not that common in general GI, but it's pretty much, it's more common in advanced endoscopy.
Yeah, I think when I switched from like San Francisco to Oakland, yeah, it wasn't part of my contract, and I think I asked my no in California or something. So.
Christina, you kind of were cutting up there. I don't know if that was just me, but if you could repeat that, might be helpful.
Could you repeat that again? Sorry. She may still have spotty service. Okay. Christina, you could repeat that in the chat box if there's any way to do that. That would be great because I think you were.
Yeah. No, I think I said. Is it better now? Yeah,
it's better.
Okay. I think I asked my lawyer when I was switching jobs, and he said like it shouldn't be in for California or something like that. I think I specifically asked him that. Yeah.
Okay, great. That's helpful. So one question that you guys, several of you addressed, but it came in earlier in the sign up, was how do you go about contributing to the education of fellows if you are not based at an academic center? And how should you think about that if it's important to you to, to train fellows in terms of how to think about that in your search for a job?
Yeah, I think that's a good question, especially for people that maybe enjoy teaching, but may not necessarily want to be at a traditional academic program. So there's a lot of programs that actually are represented on this call that are sort of affiliated teaching programs that have fellows or trainees that can rotate as part of their regular rotations. Highland is one of those. Santa Clara Valley, a lot of the county, the VA programs definitely, and many of the Kaiser programs. The other potential opportunity that I encountered during fellowship is some private practice or people that are in private practice type models, volunteer in fellows clinic. So if that's something you're interested in, you can always volunteer your time to staff during teaching or fellows clinic at your local university program.
Great. Jeff, were you going to say something?
No, I mean, I think it's much easier to volunteer as a clinic faculty member, much harder to do as an endoscopy mentor or staff privileges to get that. So just being realistic and frank with the group.
Got it. No, that makes sense. And then another question, a lot of you have either in your, almost everyone in their training, right, was at some sort of academic medical center. And so I think that's commonly what we as trainees know. And we may be less familiar with jobs that are outside of the academic medical center world. So for those of you, which is all of you, who have been outside of an academic medical center, what are the best part of not being a part of the academic medical center? Like, what are the things you are not missing by not being, what are the things you're not missing at Kaiser, Jeff, versus UCSF? So what are the disadvantages of being at an academic medical center?
Can you ask that again? Jessica, can you ask that question again?
Sorry.
I apologize.
I just said because many of the trainees are more familiar with academic medical center and what a job looks like as in an academic medical center, what are some advantages of jobs outside of the academic medical center world, particularly things that we may not be aware are advantages?
Yeah, so I mean, if you go to a private practice setting that is outside of an academic medical center, when you think about, I'm just going to be very, we think about RVUs, first of all. You go to a private practice setting, a lot of the RVUs or a portion of your RVUs goes towards education, goes towards, it's like a tax. It goes towards the academic medical center, mission, whatever it is. But if you're in a private practice setting, you know, you earn that RVU, pretty much all that goes to you. And so, and which is what translates why you may have a higher salary, for example. I don't know if there's any other advantages when I'm thinking about, you know, when we think about academics, we also think, oh, there's an obligation to do scholarly activity. And for example, if you don't want to do scholarly activity, as in like research, academic medical centers are very supportive of your other career aspirations, such as administrative work, or whether it's education, being a clinician educator. So I'm not sure if that's a downside, because I think academic medical centers are more, you know, receptive to other paths. And so the only negative I could think about is maybe a tax if you don't want it to get taxed, or yeah, I don't know.
I would say one thing I noticed immediately after leaving academic medical centers, many hospitals outside of the academic setting are way more efficient. So it's like, you know, you order an MRI, it is done within an hour. There's no, you know, waiting for the intern to order after he discusses with the attending, and then you know, things happen quickly. There's no arguing with the ICU fellow because, you know, they don't want to take the patient into the ICU. You know, Dr. Mukhtar, you want your patient in the ICU? Okay, we're moving the patient to the ICU. Like it's quite a different, I think, workflow in many hospital settings. And I was pleasantly surprised by the efficiency. And then I think at KP, they took it even to another level, I feel like, as far as the ease with which you can get integrated care for patients. So, you know, by the time I've reviewed the pathology for a new colon cancer, you know, the patient has already been contacted by some nurse navigator who has already arranged for the oncology visit and already arranged for the colorectal surgeon visit. And as just, you know, things that I didn't see at the various academic medical centers I was at. So obviously those are things that can be implemented in an academic medical center, but I would say there's more emphasis on efficiency perhaps in private practice settings, and that can be quite advantageous for people who are just really interested in doing, you know, clinical care.
Yeah, one other aspect I would add is it's not really, it's upside or downside, sort of depends on your perspective, but in general, academic centers are more sub-specialized. So for, you know, for myself, for example, I love hepatology, but in all due respects to Jessica and Bilal and Nizar, I'm not a fan of transplant medicine. So for me, you know, in doing hepatology in an academic program, you sort of have to do transplants. Whereas in a community program or a VA or the county system, you can do hepatology. I love endoscopy. So, you know, at Highland and also at the VA, I do mostly hepatology clinic, but then I also share an endoscopy. So that's, you know, one potential benefit of a non-transplant or university kind of center.
Great. Those are all really important things that I think a lot of us didn't always think about or haven't always thought about. A few more questions came in. You know, actually, I think Robert asked a good question, which is maybe not thinking about our first job, but is there a best time or a less ideal time in your career to switch settings?
It really depends on your family. I mean, I think if it's disruptive to your family, so you have to put that in perspective. So, and regarding timing, it's really about your family. If you have a family that, you know, so I don't know if there's an ideal time.
I mean, apart from like time of the year relating to schools and stuff, I think as far as like what Robert spoke to, maybe it's not great to try to or think about switching jobs 1 year into a new job. Maybe give it some more time to sort out the kinks. But I was advised by someone, one of the director of my previous program, that about every 5 to 7 years, you should think about changing jobs and, you know, kind of thinking about your priorities and opportunities for growth. If you feel like, you know, you've reached a point where maybe there's no more growth that you're going to achieve at a certain location or certain job, then thinking about a job change is a nice time to think about that. Around the 5 to 7 year mark is what I've heard.
Thanks. So I guess I think we can probably stop there unless any of our panelists have any last thoughts or advice that they want to share with our trainees and everyone else on the call. All right. Well, thank you so much to all of you for spending time with us. I know you're all very busy, so we really appreciate you being here. I just wanted to remind people of 2 quick things. One is the third session of this webinar series will be on December 3rd, so just a few weeks. And Joe Cularo, who is a new faculty member at UCSF, will be shifting away from the job-related topics, so I'm sure he'd be happy to answer questions about it. But he's going to talk to us about the approach to acute kidney injury in patients with cirrhosis as a part of this webinar series. And then finally, as I mentioned at the beginning, just a reminder to register for our liver symposium, which will take place Thursday evenings in January. It is free for trainees and free for society members. So please sign up, and hopefully the schedule will make it easier to attend since it's just several Thursday evenings. So thanks again to all of you for joining, both the panelists and our trainees and everyone else who is here. We really appreciate it. This was super helpful, I know, to me and likely to everyone else at various stages in the job search. So thanks again, we really appreciate it.
Thanks. Good night, everyone.
Bye, everyone. Thanks.
Thank you.
Thanks, everyone. Bye.
Bye.
Bye.